Hey guys, welcome to our Friday Facebook Live. I'm Dr. Greer. I'm on a little early this week because I'm heading up for my 20th high school reunion. I'm hoping the last 10 years of Botox have kind of frozen my face in place so I look the same. Fingers crossed for me, okay? But thank you for joining me today. I'm always excited to be here and talk to you guys. So today I'm going to talk a little bit about under eye circles because these are a huge problem. They're something so many of my patients complain about, men and women alike. And they're actually more complex than they seem. So first, let's talk about what causes under eye circles. When you get the dark circles, or like the allergic shiners, if you've ever heard them called in people with allergies, or in people who have darker skin pigment, it will often just be really dark under the eye. That tends to be caused by the skin being really thin, so the capillaries show, which means you see the dark circles. You can also get hyperpigmentation in that area, which is actual skin pigment. Sorry, I'm looking at my mic to make sure. Yeah, the light's on. Cool. Which is actual like freckles, but that's a lot less common. So if you see dark pigmentation, it's most likely just the thinness of the skin. Unfortunately, there's not a great correction for that. Get a really good concealer. I like the Bare Minerals concealer that's in the little palette, and it's pretty thick and gets good coverage. That's actually what I'm wearing right now. So that's the darkness issue. Then there are two other things that can cause the bags under the eyes. The first is extra skin. As we age, all of our skin stretches, and it's really common to get excess skin under the eyes. You may have even seen like the big bags. They're called festoons, and those tend to run in families. So I guarantee if you have those, you can look back along your family lineage and thank one of your parents for them, because those are pretty common too. Most people have just a little crepiness and extra skin though. So if you have just fine lines in a little bit of extra skin, laser peels can help. They're not my favorite way to treat the lower eyelid area, but they can help. They still have quite a bit of downtime, really almost more than a lower eyelid lift without the same dramatic results. So that's why it's not one of my favorites. Now, if you're getting crow's feet that are spreading into the lower eyelid, Botox there can help smooth some of the crinkles. The other issue that causes bags under the eyes, apart from the extra skin, is actually fat. There is a sheet of connective tissue that goes from your cheek to your lower eyelid, and that holds back all the fat that's around your eyeball, protecting it. It's almost like packing material. As we age, that connective tissue from here to here stretches and that fat pooches out. So the only way to treat that is an eye lift. And an eye lift actually corrects the excess fat and the excess skin in one step. I remove some of the fat from down here or redrape it depending on what's going to work best. But suffice it to say, I adjust the fat and then I remove some of the extra skin. That's what a lower eye lift does. It's actually a very simple surgery. It's one of those things that's easy to do, hard to do well, but I've been doing them for quite a while now and get some nice results. Downtime wise, I do have some other videos that we can link to about recovery after eye lift, but you are going to have some swelling and bruising. Everybody's different. I've seen the swelling last up to a couple months in people to completely resolve. Like you'll still see a little puffiness over the incision. So lower eye lift is the gold standard, most effective treatment, and it has very similar downtime to a laser peel. The other way we can camouflage this without surgery is to add filler in the tear trough. So I like to put filler at the top of the cheekbone first, and then you can very cautiously add a little the lower eyelid. That's something where you want to go to a skilled plastic surgeon who treats that area frequently. It is an area that can swell. The skin is very thin, so filler can show if it's too superficial, and there's a lot of important nerves and arteries in there. So this is one of those times you definitely want to go to a board certified plastic surgeon. So again, just to sum up, if it's dark circles, you're going to want good concealer. If you've just got some crinkles and extra skin, Botox or a laser peel may help. The gold standard treatment is a lower eye lift, but if you don't have that kind of downtime, you can camouflage things with filler. I hope you found that helpful, and as always, we'll be asking for questions next week, so if there's something you would like to hear about on a Friday Facebook Live, message me, leave it in the comments, and we'll definitely get to it. Thanks so much for joining me, and I will see you next week.